Cultural competence is really just a commitment with yourself to say that you are going to be respectful and be mindful and be humble enough to understand that you don't know everything about everyone else, but that you're going to commit to operating in the best way that you can when you deal with people who are not from the same background as you. So it really is about that commitment from you.
Cultural competency, cultural humility are so important, whether you're seeing several or very few diverse patients. And I'll tell you something else. When we talk about cultural competency and cultural humility and implicit bias, the initial thought might be this is something that helps our diverse patients, but it really helps everybody.
While Ohio does have a rich and diverse racial and ethnic makeup, we also have really diverse representation of gender identities, of socioeconomic status, of country of origin. We also have varying levels of disability status across the state. We are home to the second largest in the entire country population of Somali refugees. We're also home to the fastest growing population of Nepalese and Bhutanese refugees. And we also have an increasingly growing population of Latinx community members in the northern part of the state.
Race and ethnicity are very important parts of culture, and they can impact how patients react to an illness, how they communicate with their healthcare providers, and how much they trust their healthcare providers. So I think it is critically important that physicians and providers are educated about culture, and especially where culture interacts with race and ethnicity. So implicit bias, which is this concept that we all have unconscious likes and dislikes that impacts how we treat people, is something that we have really taken an interest in terms of making our physicians aware of their own implicit biases and having them trained in how to reduce those implicit biases. And medicine is at its very best when providers, physicians, other providers respect the basic humanity of all of our patients.
My name is Bhuvan Pakurel, and I'm a former refugee from Bhutan. I work with the Primary One Health right now, where my job is to provide appropriate language services to eliminate the language barrier for the patients who come to our clinic. Refugee and immigrants population, when they come to this country, their number one priorities are not the healthcare. Because their number one priorities are how to get used to the system. Here in this country, it is an understanding that patients need to ask all the questions, and it is expected that doctor answer the questions based on the need of a patient. Those who are born and grown up in let's say in the foreign countries, generally when a patient goes to a doctor, it is understood that doctor is the one who will be giving the medicine based on his or her analysis or finding. Now when we were there, we were not allowed to work. And not allowed to work means we're not allowed to pay tax. Not allowed to pay tax means we have no rights. And we are less than a human. So number one thing that anybody can do to whether it's a patient or a customer or a business, whatever, if you consider that individual as a human being, that is a biggest thing, biggest gift or biggest honor that you can put on that particular individual.
It's really important, first of all, to understand that it's such a range when we say disability. There could be behavioral health or mental health disabilities that someone could be experiencing, or there could be physical disabilities, or a combination of the two.
So if one is being respectful to a patient with a disability and treating a patient with a disability with dignity, what that basically means is you talk to that person like a grown-up, right? You shake their hand, you give them eye contact, which means if they're in a wheelchair, you sit so that you're eye level with them, right? You don't get in their personal space. You don't raise your voice, right? If you need them to move, you don't just take their wheelchair and start moving it. You don't just take them by the arm and start walking them away, right? You ask first.
When you don't value and understand and allow someone to have the ability to self-identify with regard to their gender, there's no way that you can provide them that equitable care.
of all the places, really, it is in a healthcare provider's office where somebody should just feel safe, right? Not to have to deal with attitudes of that nature. And I think where that starts probably is with education, right? We educate ourselves, right? So we educate ourselves as best as we can to the cultures of the patients who are coming in to see us. And we educate ourselves as to the terminology. Maybe it's a good thing for healthcare providers to know what agender or cisgender or transgender or pansexual mean.
Cultural competency is the ability to communicate and interact with people across all cultures, disabilities, identities, and backgrounds.
Diversity is enriching. It keeps life more interesting, and it enables decisions and teamwork to be more informed.
I think it's more of a journey or a path, not a destination. Some of us may be ahead of others, but we can all learn every day.
When you think about implementing culturally competent practices, these 10 universal practices are really helpful for you to remember. The information that we provide, it's not just important and relevant on the job, but at home, in your communities, in all of the spaces that you occupy. We're talking about effective communication and engagement strategies. Once you realize that you can control yourself and the way that you engage with someone and the impact that that has, you really start to see that ripple effect.